Welcome to Steady Balance on Spotify, your space to understand the science behind balance and vertigo.
Hi everybody, I am Dr. Umeek, ENT specialist working in government Gausia Hospital, Srinagar, Jeelani. So I am going to discuss about vertigo and would like to give you some basic information regarding about vertigo. Vertigo is a specific type of a dizziness characterized by sensations that a patient feels like if he has a feeling of spinning or moving when he is not literally moving. Rather than it is a perception. This is a sort of a disorder where he has not any pathological cause for it, or maybe sometimes. So he has sort of an imbalance. It imbalance may be due to inner ear or due to brain. So they are classified as central vertigos and peripheral vertigos. Who are central vertigos are associated by neurological signs, while as the peripheral ones are not associated usually with the neurological signs. They have auditory signs. We have to discuss about the peripheral vertigo. Benign proximal postural vertigo is a common inner ear disorder. Is a cause of sudden, brief but intense episodes of vertigo patient feels. It's a spinning sensation occurring due to tiny calcium crystals, autoconia we call them medical, in your inner ear becomes dislodged and floats in the fluid filled in the semicircular canals. The usual presentation of these patients are spinning sensation, false sensation of something moving around them, and it's triggered by moving of head positions. And these last for a very short duration of time, less than 60 seconds. And it may be associated with other signs like nausea, vomiting, and rhythmic movement of eyes, which we call as nystagmus. And nystagmus is an important part, differentiate between the different type of canals involved, like posterior canals, the superior canal, or lateral semicircular canal, while as the posterior semicircular canal vertigos are more common compared to other two. The common causes has been seen in benign proximal postural vertigo. Idiopathic is the most common cause. Other is aging, where the degeneration of the inner ear occurs with the passage of time, especially in the age group of more than 50 years. In head injuries, we can see patients with vertigo presenting with vertigo. Whiplash injuries, like or other conditions like ear conditions or surgeries. Ear conditions commonly we see pre-existing diseases to the inner ear, like we have vestibular neuronitis, Meniere's disease, or any other prior infections, or you have prolonged lying in some flat position. They are the most common causes how patients with vertigo present. Normally, patients have vertigo initially when they have these symptoms and signs, they neglect. They feel something, feeling of that sensation of everything moving around them, they neglect it. Commonly should not be neglected. A doctor should be consulted and in order to verify what is the actual cause. Like you can very much difficult to differentiate between the benign proximal postural vertigo and Meniere's disease or vestibular neuronitis. And especially we can differentiate Meniere's by that is a chronic, prolonged history of these sensations. But in benign proximal posture, you have a very short history. And these episodes last for less than a minute. But in case of Meniere's, they last longer than this. So commonly, the treatment is usually we have reposition maneuvers we are telling patients to do. Most of these one of the primary maneuver we say the Eppley's maneuver is being done, and that's highly effective and provides relief within 1 or 2 sessions only. So most of the benign proximal postural vertigos disappear spontaneously, and certain needs some medical treatment. Again, for that, a patient should go to his doctor and especially an ENT specialist to get examined properly and to see what is the actual cause for the this his vertigo. And it does not identify the cause of vertigo only, but an early treatment will be begun. I hope this much is enough, and I thank everybody for the patient listening.
A public awareness initiative by Dr. Reddy's. This communication does not substitute advice of a medical practitioner. Please consult your doctor for any medical advice.